Had a very scary experience with COVID, and for a brief moment my family and some of the doctors thought that I'm in for serious trouble. But I'm fortunate that I made it through, and I feel lucky to be sharing this video with all of you. Hi, I'm Dr. Rohan Khandelwal. I'm a breast cancer surgeon, and my battle with COVID started a month and a half back when I picked up the disease from a family member. Now, initially for me and my wife, we developed severe pain in our legs and low-grade fever. Those were our initial symptoms. And because our family member had tested positive, when we got our test, we weren't surprised to see a positive result. Now, being doctors, we started taking all the precautions. We isolated ourselves, and we started all the medicines which doctors prescribed to us. But it's a strange virus, and our bodies just progressively kept on getting weak day by day. And to manage the household work and our daughter became gradually difficult for us. Now, on day 6 or 7, that's when our sense of smell and taste also went away. For me, it still hasn't recovered, and that was the period I could relate with my cancer patients who undergo chemotherapy, and they also sometimes lose their sense of taste. So I really could relate very well with the symptoms which they go through on a regular basis, and I got tremendous support from all my patients, and they shared tips regarding how to overcome that, which I'll be sharing in my next video. So fortunately for my wife and my family member who initially got COVID, the symptoms got better with time, but my fever just didn't go away. In fact, I started running very high grade fever, 103, which used to come twice a day, and the shivering which I used to get with it was unbearable. More medicines were added, but still I did not respond. And on one Sunday, I remember that I was shivering so bad that my saturation, my oxygen levels also fell down, and my wife became really scared, and she had to call the ambulance and get me admitted to the hospital. Fortunately, within 2 or 3 days of admissions, my symptoms improved, and I became fever free after 3 weeks, and I can't tell you what a relief that was. After being discharged, I took 1 more week of rest, and that's when I tested negative. So it's been almost a 40-45 day fight against COVID for me, and there are some learnings which I would like to share with all of you, because this disease is here to stay, and it's better we take adequate precautions, and if we are diagnosed, we manage it well. So the first message which I want to put across is that please wear a mask and maintain social distancing. Right, this disease is not going anywhere for the next few months or years, so please take precaution. It's not a regular flu, it's a very unpredictable disease, and it's better to be safe than to be sorry and suffer from this. If you develop symptoms, please don't ignore the symptoms. Get yourself tested after consulting a doctor, because the sooner you're diagnosed, the sooner the treatment can start, and sooner the monitoring can start. And in addition to that, you'll prevent infecting others as well. The third is that if you test positive, please don't hide the result. Share it with your community, share it at your workplace, and isolate yourself. Right, it's important that you take care of yourself, but also that you don't infect others. As soon as you're diagnosed, please consult a doctor and follow the treatment which has been highlighted by them. And number 5, most importantly, do your own monitoring. Get a thermometer, get a pulse oximeter, and trust me, they are your best friends. Don't ignore the monitoring, because it has been seen even in my case, I was in reasonably good health, that even when you don't have symptoms, even when you're feeling fine, your saturation can be low. This is called happy hypoxia. That means the oxygen levels can be low even when you're feeling fine. So don't ignore your monitoring. In addition to this, another thing which can help you are chest exercises, breathing exercises. So doing deep breathing exercises, or you can get a spirometer. That is a device with 3 balls in it, and you can lift those balls, and that helps in chest expansion. That is also helpful. Talk to your doctor about getting this device as well. If you notice that your symptoms are not getting well, or if your oxygen levels are falling, do consult the doctor again, whether you require some blood tests or a CT scan, or you need admission. Another thing is post-COVID syndrome, right? So even when you recover from COVID, there are a lot of symptoms which can still remain. Weakness, muscle pain, there can, like, loss of taste and smell is still there for me. Some people are even landing up with strokes and heart conditions. So please be in regular touch with your doctor, and please don't exert yourself. Even when you're recovering, take rest. Even when your test comes negative, there's no harm in resting for some more period before you join back work. In the end, I would just like to say it's a very unpredictable disease, so you need to take adequate precautions. Please take care of yourself and don't ignore the symptoms. Right, we are seeing a lot of young people also losing their lives to it, so don't think that it is easy on young people and it's just a flu. That's just a misconception. Okay, I hope this video helps all of you. If you like the video, please do press the like button and subscribe to my channel for more videos which I'll share about my experience and how we tackled some of the symptoms related to this disease. Thank you.